Hi, I'm Donna Woolums, and I'm doing my health assessment on Carlina. She has volunteered to be my subject today. Looking at her skin, I want to look to see the color of it. She has an even tone. I noticed on her face here, she's got little brown spots here. She has one tattoo on the side of her neck. She has a scarring over here on her arm, and another tattoo there as well. Her skin, the texture of it is very smooth. There's no dryness, no scaling. No edema is noted in her skin as I palpate. The turgor on her skin is very good with brisk recoil. Looking at her back, I look for moles. I don't see any moles or any discoloration on her skin. Her skin looks very healthy. Good moisture. No edema or swelling is noted. Now, Carlina, I want to show you how to do a self-skin assessment at home. You need to get you a full-length mirror when you bathe, like once a month or maybe every 2 months. If you notice you have a mole or something, you want to look at that mole. And the things that you assess for in looking at a mole would be A, B, C, D, and E. A is for symmetry. B is for the border of the mole. C is for the color. Is it a light brown turning to dark black area? The diameter of the mole should be less than 6 millimeters, which is about the size of a pencil eraser. And you want to look and see if it elevates or it gets enlarged. If any of those are a concern to you or if it bleeds, you should see your primary care physician and let him evaluate the area. But to do a self-assessment is stand in front of the mirror, place your arms in front of you. Place your arms in front of you and look in the mirror and see if you see any abnormalities. Then you can bring your arms upright like this and you'll show the sides, inner facings of your arms. And then you want to turn toward the back with a small mirror held in the other hand and look in the mirror to see if you have anything on your back that needs to look at. Your nails. I'm going to look at your nails. And your nails you have very good hygiene. You have brisk cap refill. The cuticle is intact. You have no beveling at the edge here of your cuticle. Everything looks good. Face assessment, and we'll start with her temporal arteries. I want to palpate to make sure that I can feel them and that they're equal in quality bilaterally, and they are. Now, Carlina, I'm going to ask you, we're going to look at the face, and I know that she's even skin tone, a little bit darker under the eyes, which is normal. And as I pointed out earlier, she has these little maculas on the side of her face. I'm going to have you make some facial expressions, and we're testing cranial nerve 7. So I want you to raise your eyebrows, okay? I want you to smile for me, okay? And then I want you to frown real hard, okay? And I'm noting as she's doing this that her eyebrow lift was equal both ways. Her smile is equal, and there is no abnormalities found with the assessment of the face in itself. There is no edema, no lesions, and no, she has the same brown over here as she does on the other side. So that in itself is equal bilateral. Line, I'm just going to feel here and make sure that there is no pulsations with the trachea or gives as her carotid artery beats. And there's not. And I want to have you open and close your mouth, okay? Do it again. I'm looking and checking for crepitus or popping, and there is none. Do you have any pain by opening? No. And her mouth doesn't seem to hinge or anything as it closes. I want to do this on the other side as well. Your sternomastoid muscle. Her triangle in the front. Her posterior triangle. And the trapeze muscle. Okay. I will go ahead and just palpate around her neck. Do you have any tenderness? No. Okay. I'm not feeling any edema in her neck at all. Looks good. And I'm going to just look at your thyroid through here, the xiphoid bone, the cartilage, and then the trachea has rings through here, but I can feel them. Okay. You can feed your hip and test. So I want to hold this, and I want you to look straight at me, And I want you to tell me when you can see it come into your field of vision.
Okay. I can see it. I see it. I see it.
Okay, I'm going to test. Just keep looking at me, but we're going to test this side.
I see it. I see it. See it.
Okay, very good. Very good. I'm going to test the cover test, which is you cover up one eye. And I want you to look right at me. And I'm going to watch your other eye here. So uncover your eye. Okay. We're checking for muscle weakness, and that was good. There was no deviations of your muscles. Your eye didn't come in and out. So let's cover the other eye. Okay. Remove it. Okay. Very good. They're seeing her eyes are moist. Now we're going to do your eye exam. We're going to look at the eyebrows. They're evenly distributed on the face. Very well manicured. Is there any pain or anything up there?
No.
Okay. Now we're looking at your eyes. I'm going to look at your pupils. There are 3 and constrict down to a 2. Same with the right eye. The eyes, they do have consensual movement of them. Now look behind me and look now at my finger. Okay. Look again and look at my finger. Okay. Her eyes do accommodate, so I can say that her pupils are round and reactive to light and accommodation. We're going to look at Carly. You'll look up for me, and we'll look at the bottom of her eyelids. There's no acute redness or no lesions noted. No foreign objects are in her eyes. Now look down. Pull up. Everything looks intact. Again, no redness at the top of the eyelids. Her lashes are thick. They flow upward, as does her lower eyelids. They curl downward. So there's no fundus. Okay, her fundus is pinkish orange in color. I can see the fundus. It sits on the nasal side. Okay. I see one pair of vein and artery. And following them out, they get smaller. I'm going to go over and see if I can see the macula. And I do. I see no. Following another artery to the borders. I see 2 that crisscross toward the temporal side. One is an artery and one is a vein. In the macula, I can see. Okay, now we're going to move to Carlina's neck. I'm going to look at her neck and identify the sternomastoid muscle, the posterior triangle. We're going to test your visual acuity. So I want you to cover up one eye and then read what you can on the chart at the lowest line you can read. 2483761 EMW down, down, down. Okay. So you read in that eye 20/30. So let's try the other eye. 2483761 EMW down, down, down. Okay. In that eye, you read 20/30 as well. So that's on this test, Carlina, we're going to test your cranial nerves, 3, 5, and 6. So I want you to follow this as I move it. Very good. Continuing with the eye exam, I'm just going to shine the pin light on her and make sure that it equals bilaterally, sits in the same position, and it does. I'm going to look at her corneas. If you look this way for abrasions, there's no abrasions seen. The corneas are very moist. Right, look ahead. Look straight at me. Right, look here. Okay. Carolina's hair. And we know that the color, she has highlights. It's in dreadlock form. We want to separate her hair and look and make sure she has no scars or bumps. I will palpate to make sure she has no bumps or nodules on her scalp. Her hair texture is kind of coarse, but I believe that's because she has it in braids. At the scalp, it's very soft and it's very moist. Now, two things you want to look for, Carolina, is like if your scalp starts itching. Have you had any itching lately?
No.
Okay. You want to rule out, because you have small children in school who are susceptible to lice. So you want to make sure that you always check your head for lice. And you also want to, some people get dandruff. Do you ever get dandruff?
No, my husband does.
Your husband does, okay. So you want to always look out for dandruff. Dandruff is a normal finding in some people.